So I was asked by one of my students to make a little video about why I pick what filler for what purpose. And so we're making the video. We're going to put it on Facebook so that my PA students that I've trained in the past can reference it. So here's a bunch of fillers. These are my favorite 5, I'll call them. And the first one is Volbella, Juvederm Volbella. And it's a thinner filler. And what I really like it for is those really fine lines, like little vertical lines around the lip. You can even do crow's foot lines with it. If you're going to explore it doing anything up in the glabella, which is a dangerous area to inject, you can stay really superficial with it. So it's probably the safest to use up there, although I don't think anybody that's new should be doing any injections in the glabella. The next one's Velour, Velour XC. These XCs, after the name, just means that it has lidocaine in it. So Velour XC is almost as smooth for fine lines as Volbella, but it's a little bit heavier, so you can do big structure with it. You can do nasolabial folds, vermilion borders of lips, that sort of thing. And it's just so smooth, it's beautiful. So supposing somebody's got those perioral fine lines, but you need to do some other things that have some structure. Also, Velour is, by the company, they say that it lasts more like 18 months instead of more like a year, like most of the products. Another caveat, back to Volbella for just a second, I find it doesn't last as long as these other fillers. It's more like a 6-month kind of thing. So don't be telling people Volbella's going to last them a year. They're going to come back unhappy because you had them expecting too much. So Velour is one of the smoothest, one of the easiest ones to handle. When I'm training people, I love to use it because it just makes the training easier. Because students are surprised how hard their thumb has to push that plunger to get some product to flow. Not so much with Velour. Restylane L, historically, has always been my favorite filler. I can get it to do anything, but it's not quite as good for those fine lines. On these fine lines on the upper lip, in the area between the nose and the lip, which you can call the premaxilla, it can show, and it can look like a little picket fence of places where it shows. So it's hard to get it to be soft enough for fine lines. So if fine lines are not in the patient's problem list, then you can go up to Restylane. I like it best for lips too. It's my favorite for lips. It's just got a structure to it. You can really build corners and really lift the corners of the mouth with Restylane. So if I was on a desert island, I'd probably want Restylane because it really can do almost anything. But a close second would be Velour. Next is Juvederm Ultra Plus. So that's even heavier with structure and really deep nasolabial folds where somebody really should be having a facelift. Really deep labiomental folds, pre-gel sulcus. While Restylane will work all right in the pre-gel sulcus, Juvederm Ultra Plus XC has got that extra structure that you probably want. Then if you're trying to build cheekbones, you're really going deep and you're really just trying to build facial shape, then it gets to be Voluma, the most expensive of these. So Voluma, you might use a lot of it too, because the deeper you go with fillers, the less it shows. The deeper you go, the less it shows. I'm a rapper. It goes deep. You can put it practically right on the bone. So that's what you use for structure, and you'll use sometimes 2 or more syringes. Whereas with these other products, because they go superficially, 1 syringe usually helps the patient as satisfactorily. So from thin to thick, those are the big 5. Now, there is another Galderma product called Restylane Refine and Define. The 2 of those have more elasticity to them, and that's said to be an advantage when doing nasolabial folds because the area is so active. And I haven't really had a problem with regular Restylane in that regard, and that added elasticity may be some sort of an advantage. But when you're actually administering the product, because it is elastic, there's a certain amount of compressibility to it in the syringe. In other words, your thumb presses and the thumb moves, but no product's coming out yet. Then the product starts to flow, and then it's continuing to flow after you take your thumb off. So I don't really love Refine and Define. I'm sure some people do, but it does make the big 5.